I'm Christina Ellis. I'm the manager of the Academy at NHSA. Debbie couldn't be with us today, but she wanted me to tell you all, welcome back if this is your second part of the series, and welcome to the series if this is the first session you're joining. I want to start out with a little context and goals to what we're doing today. And our goals for the series are to create this sense of renewed energy as we go into the new program year, to connect with our peers and to learn from bold leaders. As leaders, it's our job to sort of set the tone and the culture for our department or our organization. And a lot of the times we are filling up the emotional bank account of everyone around us, and it is draining our own emotional bank account. So this series is an opportunity to give back to you and to learn from bold leaders. And the bold leader that we have today, I learned about her through others. I felt like I knew Paula before I even met her, because every time that someone would mention Paula, they would have this great story about the connections that she made in her community or the partnerships, or just overall what a fantastic person Paula is. So I've been really fortunate to be able to get to talk to Paula as we were developing this webinar. And today she's going to share her experience with collaborating with partners in the community. So if you're not familiar with Paula, she's a retired Head Start director from Community Services for children in Allentown, Pennsylvania, where she spent her career building partnerships and watching those partnerships inspire phenomenal outcomes for her programs, children, and families. So today we're going to hear her perspective from the ground and leave with some new ways you can approach building long-lasting, effective partnerships in your community. So I'm going to go ahead and turn it over to Paula. Welcome.
Thank you. Thank you for that lovely introduction. And I'm glad to see so many of you today participating and making a commitment to bold leadership. I hope today to talk a little bit about building partnerships, a variety of ways to do that, and particularly how to build partnerships that will really last. I'll begin by doing just a brief refresher on the performance standards on community partnerships. Hopefully we can evaluate your own partnerships, talk about different types of partnerships, what are some of the key ingredients to having successful and lasting ones, and last but not least, strategic planning for partnerships. Along the way, if you have any questions, please feel free to put them in the chat room, and we'll certainly make sure we get to those. So just a brief review of the performance standards. I think all of you are aware that we must establish ongoing collaborative relationships and partnerships with a variety of types of community organizations. And these can come in so many different ways, whether it's a procedural contract or arranging for certain services. But basically, in general, these must be responsive to children and families' needs, sometimes family partnership goals, and the community needs following your assessment of the community. In addition, we must establish necessary collaborative relationships and partnerships. So this is to make sure that all of the services we're required to provide comprehensively to families are accomplished. And this can mean groups such as healthcare providers or mental health consultants, managed care networks, and so forth. And also it could be entities that provide services to children with disabilities, family preservation and support services, or child protective services, educational and other types of cultural institutions within your community. Certainly important are temporary assistance for needy families organizations, nutrition, workforce development, adult literacy, any type of ongoing supports that enhance family stability, housing assistance, domestic violence prevention and support providers, and other organizations or business that can provide support to the program. So those are the kinds of types of community partnerships we are required to form in Head Start. In addition, the performance standards talk a little bit about coordination with other systems. There needs to be a memorandum of understanding between Head Start and the entity that's responsible for any other publicly funded preschool programs. So that could be your state. If your state has a quality rating improvement system, Head Start must have a relationship and participate in some form. And also, if your state has a data systems integration with other systems, we need to be part of that system as an early childhood programs to the extent that that is feasible. So that's what that's what the Office of Head Start expects of us. But apart from those expectations, I have certainly found that building community partnerships is really critical to the success of the program. And this is really what the research tells us. Tells us that good community engagement helps family to meet their basic needs. It fosters the use of enrichment resources. So we can do better if we have more and more resources that support the programming. It results in a welcoming and also a trusting community. And Partners offers resources that respond to family strengths and needs. I think the National Center on Parent, Family, and Community Engagement, based off of the net format there, says partnerships have long-term benefits for children. Research has shown that higher student achievement is linked to programs that partner with community agencies to engage families in supporting their children's learning at home. So we know community partnerships are really very, very beneficial to both the individual family and to the program at all. So I thought maybe we could start with finding out. I have 4 key questions for you. We're going to start with the first 2. And I would ask you to participate in this poll so we can find out really where are you at with your community partnerships. So we're going to get started with that very soon. And here's the questions. The first question for our poll says, currently on a scale of 1 to 5, how satisfied are you with your current partnerships? 1 is very dissatisfied and 5 is very satisfied. Okay, so people are joining and responding. Looks pretty good. Fortunately, so far, there are not many programs that are very dissatisfied. That's great. But there are some kind of, let's see, it's climbing here. We're still getting some responses, so we can wait a little bit more. Okay, that's looking pretty good. So unfortunately, there's only 5% of you that are really satisfied with your programs, very satisfied. But fortunately, a small percent, 2% are dissatisfied. Looks like the majority of people really are feeling okay. And another 42% are feeling pretty satisfied. So that's wonderful. And the next question is, do you regularly evaluate your community partnerships and incorporate your community partnership goals into your overall strategic plan? So maybe we can take that question now too. So I'm just checking, am I supposed to do something for that poll or, okay, here we are. Well, that's the same one. I'm not seeing the next poll.
If you
just scroll down.
Yeah.
Okay, great. Can't go any further than that right now. So in terms of the second question, I can see that 70% of you are regularly evaluating your community partnerships. That's wonderful, because that's really an important step towards ensuring that you have the partnerships that you need and want in place, and also you know, are planning for the future. And 30% of you are not currently doing that. So we have a little bit of conversation to have about that. Thank you. Let's move on to the next 2 questions then. I'd specifically like to know if, other than the program director, do you have an individual responsible for developing, maintaining, and supporting community partnerships in your program? Fantastic. Looks like people are really clear, and that would probably be your family community partnerships manager, someone who is responsible other than your director. Small amount of programs are not doing that right now. And then our second question, do you regularly evaluate your community partnerships and incorporate this into your overall strategic plan for your agency or for your program? Okay, that's all looking pretty good, that people are regularly engaged in this practice that ensures success. I think it's also wonderful that you have, the majority of you really do have somebody in place that is responsible for this work. Great, that's really great news. So that gives me a good idea of where you're at. For those of you who weren't too satisfied with where you're at, I'm hoping that the rest of the presentation will give you some tips on that too and stimulate some thinking. Okay, we can move on then. Okay, so I'm trying to advance the screen. Is that we're still stuck on the poll there? Because I'm having a little trouble doing that.
The poll should be down. Are you able to advance it now, Paula?
No. Oh, maybe, no. Can everybody still see the screen? And you can see that it's stuck, so it's still sharing, but was it? Okay, so here's the poll again.
And then we went ahead and exited that.
So do I need to exit it too?
Yes.
Okay, so I've done that and we're still stuck here. Sorry for the technological situation. Let's see.
Let me see if, how about stopping share screen and then reshare? If you notice, this is not a bold leadership on technology. That will be future courses.
Let's see now.
Are you able to move forward?
No. It must have something to do with the poll. I mean, it says I'm screen sharing, but I can't advance this at all.
Let me see if I can pull it up on my screen.
Okay.
So if you want to continue with
Oh, wait, maybe now I can.
There we go.
Okay, so something just, sorry about that, everybody. So we've been through, let me just get that. So generally, you know, each type of partnership is really very unique, and many times they come about for different reasons. Sometimes it's because a critical need has arisen, and I think the pandemic probably gave rise to different types of partnerships. So when there's a critical need, sometimes that happens. Sometimes it's really to solve a big problem. The program is having a problem, or the community has a problem, and we need to find a way to address that. And sometimes it's just really to advance your program services. You might have all your services in place and they're pretty good, but if you had a strong partnership with somebody else, it could be even excellent. And basically, I see partnerships forming when great minds like each of you collide, and this is met with strategic, bold leadership. It took me a long time to learn that part of my future planning had to really take into account thinking strategically about the future and where we were headed. It's funny, it's only, all right. And then I'm going to give you just an example of 3 types of successful partnerships at the agency that I was leading at Community Services for Children, which is in Allentown, Pennsylvania. And the first one really was the combination of Early Head Start partnering with our child welfare agency in our community. And it came out of, it started a long time ago in 2002, where we identified a really significant need in the community and also a significant problem in the program. And that was that there was, first of all, a high number of open child welfare cases in the 0 to 5 population. We had a high number of these children entering Head Start with very challenging behaviors, really due to the impact of abuse and trauma, and they were not enrolled in Early Head Start. And both child welfare and Head Start were serving the same families, but we weren't very well coordinated. And, you know, we knew that children and families who were experiencing abuse were not doing well. They weren't doing very well in terms of safety, child permanence, or even healthy child development. So our child welfare organization, which we call Children and Youth, and Head Start really began talking about the program. And as a result, when the Office of Head Start offered an opportunity for early Head Start programs and child welfare to collaborate nationally, we were really positioned to respond to that application. So in 2003, it was our first start of an early Head Start child welfare collaboration. We had 15 infants, and we called it Early Head Start Safe Start. We began serving the most vulnerable children, which were drug impacted, abused, neglected infants, ages 0 to 3. We created a center-based therapeutic setting with the Office of Head Start funding, and we entered into a comprehensive partnership with 2 county welfare agencies, early interventions, private therapists, and also a local hospital. Important to note that we had financial support for the program from each county. So each county really made a promise that they would continue to fund the program. And so this type of partnership really was addressing an unmet need. There was really not enough assistance that was comprehensive for children who were drug impacted, abused and neglected, and we also did not have adequate coordination with the 2 systems. So the partnership launched in 2003, worked really well. In 2008, we were able to expand to 40 children with additional support from 1 county and also additional support from the Office of Head Start. At that point, we developed an infant family center. And in 2010, we were able to expand again with another 32 children, meaning we have 72 in that program right now. Developed another new center with support from one of the partners, the Lehigh Valley Hospital. So I use this to illustrate the fact that we started out kind of small with 1 partnership, but we continued to build on that success. And what happened is it opened the door to another great partnership with another large institution, the hospital. And both partnerships continue today. So starting from an idea in 2000 to a beginning step in 2002, and here we are 2022. And both partnerships are really thriving today. So some of the things that we learned that really works, we found very early on, we needed to establish a very detailed written agreement that really assigned roles, responsibilities, and costs. We established a core team of managers and decision makers and assigned it responsibilities. We met regularly, weekly. We met weekly for years, and that really involved the higher leadership, the directors, the managers involved, and staff. We set up a format for problem solving, sharing and talking openly, and that took quite a long time to get to that point, but we were able to create a safe zone. We determined who the chief communicators were going to be so that we didn't have 10 people communicating to 10 other people, and really streamlined communication. We also reviewed monthly data. How were we doing? We evaluated all of our processes on a regular basis and did have to pivot as needed and make changes. Annually, we would step back and really evaluate the entire program, including our agreement, and determine if there was anything that needed to change. And probably most important, and one of the things that I have found over time sometimes gets lost in the partnership, we remain staying focused on the mission of why we were working together and what was it really all about. And sometimes that took reminders of each of the partners, of, kind of a rediscussion about why are we doing this work, and why is it important to continue to do that. Sustaining partnerships, as you all know, and certainly we've learned, sustaining partnerships is not simple. Sometimes it really seems like a Herculean task. Some of the experiences I'm sure you all have is there can be changes in the key executive leadership. We were dealing with a county system and a hospital system, and there were multiple changes in county government leadership. There were changes in the site supervisors and the people that we were working with. We found that we didn't really understand each other's rules. County government or child welfare has its own regulations, and of course, Head Start has plenty of regulations to go around. So we really had some trouble in our communication since we didn't understand each other's core regulations. We grossly underestimated the amount of time needed to support the collaboration. and we found that we had a difference in philosophical approach, that partner goals started to wander a little bit. And then we also found that even when we get the partnership kind of straight, we would have to constantly respond to changes in the community. So when the opioid crisis came about, we found that we really needed to make room and think differently about the families that were affected there, or as laws around child abuse changed, or again, of course, with a world pandemic, we had to think very differently too. But in this development of this very long-standing successful partnership, we learned quite a bit. We learned that really building strong partnerships does take effort, time, and real commitment. So I'm glad that you have at least one person dedicated to this, but it really takes commitment on the part of every person involved in the partnership. Relationships are critical, must have a great rapport, especially at the key leaders. We must identify and believe in the mutual goals. So really honing in on what do we want to accomplish and how can we share in them is very important. Thinking and talking about how the program and the partnership benefits each party and keeping that fresh, reminding one another of that. Creating one philosophical approach with a shared language takes a lot of doing, but it's really important. Measuring the indicators towards the goal success, really taking a hard look at is what we're doing working? Are we really reaching the goals? Pivoting when we need to. Negotiating differences where you can. I can give you an example. Child welfare services with families are not voluntary. Participation in early Head Start is voluntary. So how do you negotiate that example of two completely different regulations and serve families? Who's going to compromise? Where are the compromises? And how can you go about meeting both needs? And then, of course, communication in every single direction, at every single level, all the time, in every way possible is really essential. And last but not least, and I think this is important for bold leaders like yourself, is sometimes you have to take a calculated risk. I think there is an element of risk whenever you're starting out on something new that you're not quite sure how it's going to work. And you certainly don't want to jeopardize anything with your program, but you have to take a little bit of a calculated risk and have a backup plan. If the partnership were to fall apart, what would you do? And then I just want to back up just a little bit here. Are there any questions in the chat room before I continue?
Not as of yet.
Okay, great. So I want to give you another example of a new partnership that was developed strategically, and it was addressed around a problem that Community Services for Children had. And I think I'm trying to back up here just a little bit. Sorry, I'm having a little trouble with advancing, and I apologize for that. Got a little ahead of myself here. Okay, so we had really identified in Allentown that Head Start did not have adequate space to expand or serve children. We were really sorely lacking with facilities that were located in the area of greatest need, which was Allentown. So our agency really said, okay, our number one strategic goal for the entire agency is going to be to find a permanent multi-classroom facility to house Head Start now with space for expansion. So this really took a commitment on the part of all aspects of our agency, our board, and our policy council to say, for the next 3 to 5 years, this is our number one goal. So we took a look at then, of course, what the strategies would be. We involved parents, we involved our board and staff to search for space. We engaged realtors, which we really hadn't been doing too much of before. We started using public communication tools, op-ed pieces, website, newsletters, presentations, social media to say that Head Start was in search of a permanent home in Allentown. We sought out real estate developers, talked with government leaders, corporations that we knew were concerned about a future workforce or who had an interest in education and early childhood education. We evaluated what was happening in the city, and we kind of started finding out, well, who's involved in the redevelopment of the city of Allentown? We identified some key business leaders who were in a position to help, and we sought opportunities to get in front of those people and present our needs to them. We leveraged other relationships to get to an individual we thought was a key player. So in Allentown, there's a corporation called City Center Corporation that was largely responsible for a lot of the real estate development going on at the time. So we kind of, once we learned that, we were saying, well, how can we get to talk to this individual and the head of that company? None of us really knew that person, but sure enough, a person on our board said, I can get you an invitation. So we started talking, we communicated Head Start's value, its outcomes, and what our problem was, that we had no ability to grow due to the physical constraints of a facility. And we really created a sense of urgency. Every time I had an opportunity, I would say to people, we're not going to be able to continue to serve the number of children who are waiting for service in Allentown until we get a new facility. So what happened really was City Center Corporation stepped up, and they said, look, we have a building that's not being used, and we're going to renovate a space for you on the first floor. And we created a beautiful Head Start Center with 6 classrooms and lots of opportunities for innovative programming. And what happened is they really led support from other businesses and community programs to make this happen. So it really just took getting in front of the one key leader and convincing him that he could help. And this partnership started in 2018. In 2020, we expanded the square footage. We created a neighborhood resource center, plus 2 more Head Start classrooms. And really, our partner became a champion for Head Start. They started finding out every single way that they could really help, and really understood why the unique qualities of the type of comprehensive early childhood education that Head Start provides, and the need for parent engagement, how special that was and impactful it is, and really became a supporter. So here we are, sure enough, in 2022, there's another large expansion in the works with a 30-year commitment from this company. And really the Head Start program and Pennsylvania's Early Learning Resource Center program and a healthcare provider are going to take over the entire building. So we're going to end up with 20 Head Start classrooms there, which is really a dream come true for us. And as I said, you know, part of the success is communicating our vision and our success as much as possible. We were fortunate to have a visit from our governor, who heard about what we were doing, and this business private public partnership really got involved, and a visit from the First Lady and Secretary Xavier Becerra. So when looking back at, I told you what strategies we put into place to try and make this partnership happen. And, you know, there were many times that I found myself saying, like, wow, we just really lucked out. We're incredibly lucky. And maybe there's an element of luck involved. But I like to think of it as an intentional strategic preparation that met some opportunity. And we just got in touch with the right people. This picture shows Dr. Bergeron there in the middle, who came for our ribbon cutting ceremony when we opened in 2018. So we believe the key ingredients to this partnership's success were really, again, building relationships at every single level, building commitment by sharing positive outcomes, and also getting other businesses and social programs involved. The more the community gets involved, it's pretty hard to step away from a commitment like that, and because everybody joins in the commitment. Constant communication in every direction. This is important. Reliability. Our partner really said to us that we were one of the first social organizations or educational organizations that he had worked with who did exactly what we said we were going to do in the time frame that we said we were going to do it. So having that sense of accountability and reliability really helped to build it. We constantly reiterated our short and long-term value to the community at every opportunity, gave recognition to our partners regularly, and then really continued a sustained leadership approach, which is really very important. The last partnership, go ahead.
I was going to say, before we go into the last partnership, we do have a question.
Okay.
And the question is from Rebecca. Do you serve a lot of foster children, and how do you handle families that need enrollment quickly?
So I assume you're talking about our collaboration with child welfare, if that's the partnership we did have a lot of foster families. Fortunately, I would say that because one of our goals, of course, was to reunify where possible and shorten the length of foster care with getting them back to their biological parents or parent when possible, or grandma or family. From time to time, those foster family situations really stopped. In fact, we did significantly reduce the amount of time any child was in foster care. When they were in foster care, we worked with the foster care parents and their biological parents at the same time to all benefit the child. How we created slots when they were needed, that was a challenging situation. But when child welfare felt that they had somebody who really needed to come into the program, maybe a new baby who's 4 weeks old, really experiencing the effects of drugs, what we would do is sit down and evaluate that and look at some of maybe the older children in the program who were perhaps 2.5 at that point in time, who were thriving, who were doing really well. And then with the permission of the parent, we would offer them the early Head Start home-based option that we also operated. So we had the benefit of this therapeutic program and also another 165 slots at the same time in our home-based program, which tended to have more openings, frankly. So we were able to still provide early Head Start, not drop that child from early Head Start, but make room for a more critical infant coming into the program. That said, it still had some of its challenges.
Thank you, Paula.
Sure. Last partnership is with a school district. And I want to say that for many years, we had various forms of relationship with our Allentown school district. Again, this is the city that has the greatest need, greatest concentration of poverty, and was a struggling school district. We had created a memorandum of understanding with them, but didn't really hold a lot of water. It just was sort of on paper, and we would make some efforts, but things weren't that coordinated. So once again, we really said, well, we have this partnership, but it's not going as well as we'd like to. So we created a strategic objective, and that was to improve the relationship with the intentional intention to increase coordination and planning, to improve transition services of children leaving Head Start, and also to obtain some free classroom space within some key elementary schools, which again is something that our program really needed. So we went about, and one thing we had always communicated with the superintendent, but this time we started really getting to know our principals in our neighboring schools, the school board, how we could benefit the Allentown School District, and really specifically what we wanted. And we talked with school board people. We took advantage of every opportunity to present. And then the Office of Head Start offered, under Dr. Bergeron's leadership, really created a school district collaboration project. So we went into that project to develop, and together we developed a team of the Allentown School District leadership and Head Start leadership to work together. We identified all of our key activities and our goals, determined how we would benefit from each other. So we really kind of said, Head Start will give you more children who are ready for school, and you will give us space, which also will increase the numbers of children that'll be ready for school. So we spent a lot of time saying, this is really going to help your elementary schools, your children in school be more successful. So we began working together, and fortunately that has created some really lasting relationships. We did give a lot of publicity about the collaboration because we also felt that if more people in the community understood that we were working together, it would help sustain the collaboration on the part of the school district. So I think at this point, we're going to try and break into some groups if we can. Okay, great. I think we're all back together. I hope you had a little bit of time to think through how things are going in your community partnerships. So at this point, if we could just, I'd like to hear from 1 or 2 groups. I think we have time for that. And is there a particular group that would like to step forward? I think there were at least 8. Call
can
for a
do group
volunteer
7.
group?
I can do group 7.
Okay, that'd be wonderful.
Hi, I'm Tabitha. I'm from Massachusetts, from Beverly, Massachusetts. I am a program manager at North Shore Head Start.
Okay.
And we were talking about space, just finding adequate space for the classrooms. The provisions of the transportation was a very big issue last year, and one of the ladies we were speaking to didn't get lifted all of last year. And I think being in a public school, it's hard because you don't know what's going to happen year to year. One of the ladies was saying that they gave her classroom away in May and didn't tell anybody until they were
Right.
enrolling children.
Right.
I think that's a big thing is you don't know. We don't have bus staff, or you don't know if staff's coming back after the summer break. It's just very hard to find people right now.
So that was really one of your biggest challenges with space in the school district, public school, correct?
Yes, definitely.
So what key ingredients do you think maybe would be beneficial to apply in that situation? Did your group talk at all about that?
We didn't have a chance because we went from 5 minutes to 2 minutes. It went very fast.
Oh, okay.
Yeah, I think just networking. I think just collaborating with the public schools and all the communities. Where I'm living, they're building new schools right now. So you get that relationship to be able to see if you can get a little wing or a couple of classrooms there. And just building the community with the principal, whoever you can.
Yes, I think, you know, so first of all, I experienced the same situation more than once where we had 5 different classrooms in 5 elementary schools within a district. And, you know, somebody in July would say, oh, we're not giving you that classroom again. And we had a lot of difficulty getting, you know, anything more than a 1-year commitment. And as I said, sometimes that it was being disrupted even within the year. So I relate to the challenge you're talking about. I think in public schools have so many issues themselves. The one thing that I would suggest is if there's a way for you and others in your program to really work hard at strengthening a key relationship with the superintendent, the variety of leaders below the superintendent, so that they get to know you so well that they feel really badly if they're going to kick out Head Start. And the same thing with the school board. If you have an opportunity to get connected to 1 or 2 people on the school board so that you're saying Head Start needs this space, we really have to be there. Here's why it's beneficial. They might, if they get wind on what's happening with the district, that somebody maybe made a very casual decision without truly understanding the devastating outcome it can provide. Sometimes that helps prevent it. And that would just be my suggestion there.
Our director is really good at networking. He goes to all the, community meetings. He
Good.
knocks with whoever he can. So we're, it's working. It's
Good.
in progress, I should say. It's a work in progress.
Excellent. Good idea. Okay, how about another group? Just
There
we have
was a hand risen, and I hope to, I might not pronounce the name correct, but Rosida.
okay,
Yes.
Rosida?
Hi, my name is Rosaida Iraola. I am from Philadelphia.
Okay.
And I think that the common denominator in your example, and then also in most of ours locations that we are in, participating in this training, is actually serving the children, reaching out to those families that need support and serving children. That's our common denominator. Even if we need staffing, or we need space, or we need money, fundings, or at the end of the bottom of the line is that we need to serve children. And I think that the key ingredients that it was out there is that we have to recognize our own selves as initiators. We need to recognize ourselves on advocates, and we need to put up front and reach out and knock on the door. If we don't knock the doors of the leader around that, of those agencies and organizations and politicians that we need support from, or that we need to partnership to build strong relationship, if we don't do the outreach, communication, open that communication. That's the initiative on the key ingredients that we need. And to identify one point that we here in Philadelphia need more support of is, of course, like everybody else, fundings, and then also staffing.
Sure.
It's really hard for us to get staffing and keep them, and most of the teachers that we get a hold on, we support them into going to from Cert 1 to Cert 2, and once they get that, they go to the school district because they better pay. And we have to be realistic. You know, most of our Head Start programs do not, you know, put a lot of money in our pockets.
I understand.
And you know, they need to pay student loans that are out, you know,
Right.
out there that are reachable to, and everybody struggle with that. So there is a pot of benefits that we see that affect us. Child cares and Head Start programs and pre-K counts program hold on to qualified staffing, and you know, it's something that we need to advocate for. And
Sure.
the best way is to, you know, call our representatives when they're making those decisions on budgeting for programs, and put the voice out there.
Absolutely. Yep, that's very important. I liked what you said in the beginning, that it's really all about serving the children. So finding partners that have a mutual commitment to, hey, we're serving these children and they need us, and so we're going to do it together. And staying focused on that is really an important part of the successful partnerships. That's great. So thank you very much for that that feedback. I think just really, you know, some of what I see as the lasting success is you really need to know what each party truly wants from the partnership. And you need to understand what values you have in common, commit in writing to mutual goals, objectives, and a process, deliver on what you're going to do, communicate to everyone involved frequently, be out there, conduct research outreach, just like you said, be leaders out there, and make sure that everybody's contribution is really appreciated in every way that you can. And lastly, I would just say that in order to really make lasting partnerships, you just have to keep going. You have to sustain the partnership, and to do that, you have to continue to lead the effort, be a bold leader, be out front, and just keep going as best as you can, even with the challenge that you're facing. Make sure that you're thinking strategically and creatively. I think that often we don't think about business as a potential partner, and potentially a partner that can provide funding. And maybe we don't think enough about county government, but in general, really take a good inventory of your current partnerships. Are they working? What is happening in our community? What's our capacity for leadership? And start thinking about where you want to be in 3 years. Who is a potential partner, and look in unusual places. Last thoughts: partnerships and collaborations improve outcomes for children and families. They broaden your reach and access to services for families. They strengthen programs and strengthen people, and really build community. So I'm going to stop there and thank you, first of all, very much for this opportunity to talk with you today. If there's any last questions that I can take, I'd be glad to before we wrap up. Thank you.
You can put your questions in the chat, or you can unmute and ask as well. I also wanted to share, Paula, that we did have another group put in their feedback that you
great.
Take a look at later as well. But are there any questions for Paula?
No questions. Is there another group that would like to share anything you identified? I guess I'm really hope. Go ahead. Go ahead. I think one of the things that I skipped over a little quickly. I'm sorry, back to this. I'm telling you, I'm not quite sure what happened there. I think that it's really, one of the things that I learned over time that I had probably really had undervalued for some time was this idea of truly planning for partnerships. I think in Head Start, we do a wonderful job of planning every other service and creating plans for achievement of our goals. But often our community partnerships were something that just sort of happened, but again, because we had a need. And I think that happens and that's important. But I also think it's really important to take stock and begin really looking at what are the changes happening in your community? Where is your community going? What are the big problems? And then very strategically start planning for how they can be solved, not only within your program, but by collaborating with somebody else. And it does take a lot of effort. And I do realize that when you're struggling to fill slots in your program, fill slots or fill employment, I do understand that this is something that might end up at the bottom of the list. That said, our staff who work in these collaborations are also the people who've stayed with us because they really like what they get out of the partnership. They like being part of a bigger relationship. So we have found that it's also very beneficial to some other aspects of our program. Funding, it's brought money and resources to us, but it's also helped us to retain some of our staff. So I'll just add that as a last comment. And then I think I'm all done. If there are any other questions, we have a minute or two.
Yeah, as I'm closing up and sharing information about the upcoming webinar series, if there are any more questions, put them in the chat. I wanted to take this time to, first of all, thank Paula for her time and for the work that you have given to the community and sharing it out now with others. And so we can go and take it back into our communities. If everyone can do a little reaction clap for Paula there so she can see them. If we were in person, we'd all be clapping really loud. So thank you, Paula, for that. I also want to remind everyone, like I did at the top of the hour, that this is a webinar series. This is the second of 4. Our next one is going to be next week at the same day and time. And we're going to have Ray McNulty, and he's going to talk about living in a world that's volatile, uncertain, complex, and ambiguous. And how do you lead in challenging times? And so information about that webinar series is going to be dropped in the chat down below. I want to thank also the attendees today. Thank you for taking time out of your busy day. As you guys were describing in your groups, these things that are happening in your communities and challenges that you're having, and to take the time out to come and be inspired and learn about how partnerships can be a solution for those challenges and concerns. We really appreciate that as well. Again, thank you everyone for your time. And again, the recording as well as the slide deck will be sent out via email after this session, and also will be available on the NHSA website. So thank you everybody, and enjoy the rest of your day.
Bye everybody. Thanks again.
Bye.
Keep being bold. Take care.